Hi, UMA students. It's your instructor, Vicki Weissman, here once again to talk to you about therapeutic communication across the lifespan. This time, we are going to be talking about communicating with older adults. We all, I'm sure, have had experience communicating with older adults, whether it's a loved one or a friend, or maybe in a job that you have currently or in the past. We have had experience and we know that it can be challenging at times because there's differences in sometimes their hearing, their vision, or other physiological components. So let's go ahead and get started. Let's start with a scenario about a patient we'll call Mr. Smith. Mr. Smith is an 82-year-old man who is going in for a doctor's appointment because of some concerns he has using the bathroom. During this appointment, he brings his daughter in with him. The doctor does an examination and tells him that he does have prostate cancer. Now, that obviously can be very disconcerting to hear that you have cancer. But Mr. Smith is lucky because he has a very wonderful doctor. His doctor takes the time to explain the illness to him, tells him that he did the right thing by coming in early and getting an early diagnosis. He then shows him some pamphlets and gives him some things to take home and read. He shows him some pictures on an iPad he has so that he can explain the illness a little better and what the treatment options will be for Mr. Smith. The doctor then proceeds to talk to Mr. Smith's daughter and make sure that she understands what is going on with her father. It's always helpful to have a second person in a doctor's office with you, really regardless of your age, because sometimes when you've been given important information, you don't always remember it all. And having that second person there with you can greatly help when you go home and you try to recall everything that's been told to you. That can very much be true when you're dealing with an older adult who may be dealing with memory deficiencies. So, what do you think? Do you think the doctor did a good job taking care of Mr. Smith and his daughter? Why do you think that he did a good job? What are the communication strategies the doctor used to help Mr. Smith? Let's think about those things as we go and learn more about the therapeutic communication approaches for dealing with older adults. I'm going to go ahead and share my screen with you all. And we will take it from there. So the therapeutic response across the lifespan. Older adults. Now, older adults typically range from the 65-year mark and up. People are living a lot longer these days, so we have many adults living into their 90s and even into their hundreds. With older adults, you're going to have more chronic illnesses than acute. They might have hypertension leading to heart disease, diabetes, arthritis. They might have hearing and vision impairments. People might be dealing with strokes, memory loss, and other progressive diseases, like, for example, Parkinson's disease. Older adults might have a loss of self-identity or self-belonging. Maybe they are retired or about to retire, and they just don't know where they fit in society anymore. Their roles are changing. They're not taking care of little kids, and they're not working every day. So they have to find a way to fit in. This can, for some people, make them sad and can cause some depression. Some older adults, though, might love it and feel very independent. They don't have to take care of anybody anymore, and they're healthy enough to just focus on themselves and take care of themselves. They can go and pursue activities that they've always wanted to do, take on new hobbies, or maybe really get into a hobby that they always loved but didn't have enough time for. Maybe they can even travel, go spend more time with their loved ones, and just really enjoy life. That's what most of us or all of us hope to do as we become older adults. As I mentioned before, there is an increased life expectancy these days, mostly because we have such a good healthcare system and people are learning how to take better care of themselves. We are leading productive lives, but one thing that can set older people back is they can get a little depressed, as I mentioned before, because they might be having a greater loss of loved ones. Friends, family members who are always a big part of their life might be passing away, and this can be very difficult as they progress as an older adult you may be working with progresses in age. You might think to yourself, why is it important to watch this video and understand about the older adult? Well, I just want to point out that as a healthcare employee, there's a great chance that you will be working a lot with older adults, depending on what job you get after UMA. Whether you're a medical administrative assistant, a biller and coder, a healthcare accountant, or even working in technology, you might be having to deal with older adults, and knowing this about them, where they're coming from, how they're feeling, what their communication abilities are, will give you the ability to interact with them more effectively. One thing to remember is older adults are present focused. They want to know what's going on with them, the here and now, because they don't know what the future holds for them. They want to enjoy each day, every day. They might have a decreased language sophistication, whether they're having hearing or visual impairments. Those things can affect their speech. Also, their writing abilities can be affected if their fine motor coordination isn't as good as it once was. All these things can affect how well they communicate. As I mentioned, the hearing obviously can affect their ability to hear you, and their vision can affect their ability to possibly read your nonverbal communication skills or read written information that is provided to them. They might have that loss of self-identity as to where they fit in our society. And they might have financial worries, which is something to very much keep in mind, because when they are diagnosed with a health care issue or maybe need to get expensive prescriptions, those financial worries can make them feel stressed, and maybe that stress might cause them to not be the nicest communicator. If you maybe you're talking to them on the phone or in person, they might get a little short with you, and it could possibly be because of financial worries, because many older adults are on a fixed income. So as we always do, we're going to talk about Erikson's stages of psychosocial development. For the ego integrity, they versus despair. Older adults, they have a strong ego. They feel like they've had their life experiences and they know a lot to share with other people. But they also might feel despair because they see their days on our world getting shorter maybe, and not being the same person they once were. Seeing people they care about pass away. So they're kind of trying to um, balance their life with those different thoughts in their head. They can be thinking of retirement or have already retired, and really be looking back on their lives and their accomplishments. You hope one day that when you're in that position, you really feel good about what you've accomplished in your life, which I know is a big reason why a lot of you are here today at UMA. And you want to feel that you've lived your life to the fullest. Unfortunately, not everybody does feel that way, and you might run into that despair. Physically, their body or mind both may begin to fail, change, not be the same person, not have the same endurance, not be able to walk like they used to, or even sit in a movie. They might have incontinence. They might have breathing issues. They might have memory issues. They might have eating issues. There's a lot of different places where your body can change. And these things can, of course, cause some despair and concern, worry for the older adult. So how do we therapeutically approach to get desired outcomes? We want to be empathetic and show compassion, help them reflect on their feelings so that they feel fulfilled, so they feel like you understand where they're coming from and you respect them. You want to give a firm handshake if you're allowed to, or maybe a elbow bump if you feel like it's appropriate, or at minimum, always have nice eye contact. You can never go wrong when you have good eye contact with someone. Smile if you're wearing a mask or not wearing a mask. Show them that you care and that you're there for them. Address them by their full name and title, Mr., Mrs., if you know it. If you're not sure, then maybe it's best not to say anything at all. Well, that goes, I guess, mostly for a woman, if they're Mrs. or Ms. You want to make sure you ask their opinion, and whenever you can let them make a decision regarding their health care, please do so. Sometimes, depending on their cognitive abilities, they might have family members who are making their health care decisions for them. But no matter what, if they're in the room and you are talking about their health care, always make sure that they are included in the conversation. You never want to talk above someone or around someone. You want to make them feel part of the group because it is their life, and they know, even if they're not 100% the person they once were, they know that you're talking about them and their health, and they want to feel like they're part of the process. And lastly, you don't want to use endearing terms such as sweetie or honey or dear. You want to be respectful at all times and treat them as the adult that they are. So some other therapeutic responses to remember with older adults. You need to remember to compensate for their physiological changes, those hearing and vision losses, also possibly the physical changes. Maybe they're in a wheelchair or they use a walker. They might need additional time to get back to the examination room or to come up to the desk to check in or to answer a question. You want to keep the background noise at a minimum so you know that they have the optimum opportunities to hear what you're saying. You want to speak, as always, slowly and clearly, using visual aids if necessary. Sometimes nowadays with our phones and iPads, computers around, it can be very helpful to show a patient something on a computer screen. They can easily understand it, and it can be a great resource for you. You want to make sure people are comfortable, and you want to be very respectful of their schedule. All people like to have their time appreciated, and older people especially, they are on routines. They might be getting a ride to the doctor's office from a friend or a service, and so you always want to make sure that you're being respectful of their schedule and their time. You always want to treat with respect and value the life that is in front of you. Even if they are not the person they once were, you want to always show compassion, empathy, and respect. You don't want to be over solicitous with your words, but you want to be the professional that I know you are. Lastly, as we always talk about, and as we talked about in past courses or in past weeks of this course, you want to inquire about their cultural beliefs and their backgrounds and be respectful to those differences that they might have with you. Show interest in whatever activities, get to know your patient, care about them, if they have hobbies or about their family members. People always like to talk about themselves, and it helps to sometimes break down those communication barriers. You want to help to let them be as independent as possible for as long as possible. And also remember the needs of the primary caregivers who could be helping to take care of them, because they are important into the health of the older adult. And if they're happy, the older adult will be happy. And in addition to that, you want to always make sure you're taking care of yourself. It can be stressful and hard being a healthcare employee sometimes. There's a lot of different facets to the job. So you want to make sure you're doing what you need to do before and after work, or even during the workday, so that you can be the best employee possible. Lastly, you want to be aware of the older adult's cognition. They might be suffering from a disease that they have not told you about, disclosed, or maybe it has not been diagnosed, but maybe you notice something is not quite right, or they're not understanding you the way you would expect them to. So these are just all things. I know I went through a lot of information very quickly, but they're all things that you want to be aware of when you're dealing with older adults, which can very likely be a big part of your job when you go out into the workforce after UMA. So take some time to digest this information and think of any questions that you might have. You can always go to your instructor or consult other resources, whether via UMA or online. But think about how you're treated, how your loved ones have been treated, things you've liked in healthcare, the way people have treated you, and some things that maybe you think could be done a little differently. There's always room for improvement. Reflect on this information from the video today. Think about your assignment, your assessment, the interactives for this week. Use the information from the video and the course readings to help you with your coursework and any other UMA resources that we have. We want you to do your best. I hope this video was helpful and interesting and educational for you, and I wish you all a good day. Thank you so much.